This program is brought to you by Stanford Hospital and Clinics.
I know that you are a breast cancer survivor, and I wondered if you would be willing to share with me some of your personal history with cancer.
I am a very proud survivor of 10 years now. I had surgery in 1999. I had a lumpectomy on my left breast, and at that time they removed some portions of nodes under my arm, and there was a tiny speck of cancer they found in the sentinel node, so they decided that they didn't decide, I decided, but they encouraged me, the surgeon himself encouraged me to be rather aggressive in whatever therapies I chose, since I was only 52 at the time. And so I did decide to do both radiation and chemotherapy, went through that treatment, and I didn't even know anything about lymphedema at the time. I hadn't been counseled about it or anything, and I actually had a huge flare-up at one point about 1.5 years after my treatments and stuff. So that's how I became aware of it, and did go through some of the therapies and things. I was on tamoxifen for 5 years and then letrozole for another 5. So I've just gone off of any kind of drug therapy, and I feel good and lucky.
Wonderful, wonderful. Well, can you say a word about how lymphedema has impacted your life? What has been your experience with lymphedema?
I've had to be pretty careful about it. I don't have a huge case. I am not restricted too much in what I do. I do wear my garment, my sleeve, whenever I have to do any lifting or whenever I go on an airplane. There are some things like that that I'm pretty careful about. My first flare-up was, I had totally forgotten about, well, no, my first one, I didn't know about it. I was lifting boxes of textbooks at my school, and after a day of that, I then, in the evening, had a huge swelling in my arm. It was very splotchy red. The next day, I had total flu symptoms all day long, and that kind of scared me, so that's how I got to find out what was going on. And my second flare-up was, gee, 1 year later maybe, when I was doing some hiking that was pretty extreme uphill and overdid it, and then the same thing happened that evening and the following day. You know, as I said, I'm just careful about what I do, but I'm not conscious of lymphedema at all points. It does bring to mind one more question, though, and that's the idea of exercise. And I do an aerobics class right now with a little bit of weightlifting, and I've just done it with my right arm, not my left. So, you know, I'd like to find out more about it if I can go a little farther with that.
Sure. Well, we generally think that exercise is a good thing for lymphedema, in contradistinction to what doctors have told patients for the last 40 or 50 years. We're learning that exercise actually can have a disease retarding effect. It can help to prevent lymphedema, and it certainly can help to keep it minimal in its severity. The one thing that seems to be very important is adequate compression during exercise, because what we know the problem is that exercise brings an increase in blood flow. And if there's an increase in blood flow but the lymph system can't keep up with the extra fluid filtration, then the edema can get worse. So wearing a compression garment seems to be the magic answer.
Good.
So what's your wish list for the future? What's going to happen with lymphedema if you get your wish?
Well, I know that some people suffer terribly from it, and I just hope that, you know, that can be relieved, and I hope that I can continue on the way my life is right now without, you know, having to worry too much about more flare-ups and getting larger.
Right. Wonderful. Well, thanks for answering my questions.
You're welcome. Thank you.
Thank you.